are the dangers of not taking enough vitamin D? Okay, so let's talk about it. Today, the question I had was from a patient that was scared to take too much vitamin D because she had been reading that, you know, you could become toxic on it. And because of that, she kind of backed off from using it as much. So I'm Dr. Tinuade Olusegun if you're new here, and I want to talk about what are the dangers of not taking enough vitamin D. Maybe also touch on what are the dangers of taking too much vitamin D, okay? Because vitamin D is a very, very, very important vitamin slash hormone, okay? It's not just a vitamin, it is actually a hormone, okay? It has structurally, it's made from cholesterol, kind of like our other steroid hormones in our body, okay? So, very important to understand is that in the US, okay, more than 3 out of 4 people are deficient in vitamin D, okay? And what we classify as a deficiency is someone that when we check their blood level, the total number is below 30, right? And what we consider the reference range for normal is somewhere between 30 and 100, okay? I know that's a wide range, right? So in any way, I mean, I don't ever want to be on the low end of the range or the super high end of the range because you never know, right? Somewhere in that middle is probably optimal. And a lot of the studies that we look at is showing that if we can get our patients somewhere between that 50 and 80, maybe sometimes even 90, we're definitely going to get most of the benefits of vitamin D without the risk of toxicity. So when your doctor is checking your blood level, that's kind of what they're looking for, that you are not too low where you're below 30, but that you're also getting into that optimal range where we see all the benefits, okay? So what are the benefits of vitamin D? I'm just going to touch on a few, but it's going to be a super long video if we really want to go into why this vitamin or hormone is very important. So, but let's just touch on a few. So one is bone health. Most of us know this, vitamin D is very important for the absorption of calcium from our intestines so that we can actually start building bone, okay? So bone health is up there. And same thing with dental health, right? Because it's very important for developing strong, healthy teeth. Okay, so if you're not getting enough vitamin D and your teeth is falling out, maybe you should look into that. All right, so what about mood? A lot of times patients will be diagnosed with depression, and I will check their blood levels. The doctors already started them on some antidepressant of some sort, and I'm seeing vitamin D level like in the low 12s. I'm like, really? Like, no, we need to fix this first before we even put you on an antidepressant, okay? So let's fix vitamin D because it is very important for mood regulation, okay? So you're going to feel depressed if your vitamin D level is low, okay? So why do you think people that live in areas that are very low in sunshine usually feel this gloom and doom? Sometimes that's why, okay? You got to get the vitamin D level up, right? So the other important thing is cardiovascular risk. So this one was one of the ones that a lot of people are not familiar with because vitamin D actually supports the healthy blood vessels. So if you're supporting healthy blood vessels, you're very likely to be improving your cardiovascular risk. Your blood pressure is going to be better, which is going to make your heart function better, which is going to make you less likely to have a heart attack. All right, so vitamin D helping your heart, okay? Now, muscle function. We do see that vitamin D does help to strengthen the muscle and increase its function, okay? So if you're having weak muscles, sore muscles, this is the reason, this might be one of the reasons why, okay? So you definitely want to start looking or have your doctor look at your vitamin D level and see if you could benefit from improving it. Also, we are very, very, very fortunate that a vitamin that our body can make can actually prevent cancer. Okay, this is one that I'm just blown away. I'm like, you know what? Give me as much vitamin D as I can tolerate, okay? Because there's very little we can do to prevent cancer, right? Besides eating healthy, you know, making sure we're not putting toxins in our body and, you know, getting enough rest, not stressing and stuff like that. But a supplement we can take or something our body can make can prevent cancer. So, for example, vitamin D has been shown in studies that you can prevent breast cancer, you can prevent colon cancer, you can prevent prostate cancer. Okay, so which of these cancers would you not like to prevent? Okay, so I'm saying, look, this is something you can do. Everybody wants to know what they can do to prevent cancer. That's one thing you can do. Get your vitamin D level up into that 50 to 80, 90 range, and you are doing your part in preventing cancer, okay? So I love this one. I definitely take it every day because of this, because I'm like, well, I'm limited in, you know, my toxin exposure. I'm limited sometimes in the amount of stress I'm exposed to, but hey, I have control on how much vitamin D I can take, so I'm gonna take as much as is safe, okay? So take vitamin D for cancer prevention. What about anti-inflammatory? It has been shown. Vitamin D can help reduce inflammation. Vitamin D is very helpful in, also, this is a shocker, reducing insulin resistance. Yes, this is for my diabetics. You want your vitamin D level up, right? Because it's gonna help your body use that insulin better, right? So when you use insulin better, what happens to your blood sugar? It goes down. So did you know you could take vitamin D to do that? That is awesome. So I'm very excited about this one. I hope that you drive that home. And you are diabetic, you should be on vitamin D, okay, for sure. I don't care if you think you live in a sunny area like Florida or California, you know, make sure you are supplementing. Have your doctor check your level if you are diabetic. You want to get that insulin resistance better, okay? So what about calcium levels? Yes, we know that's one of the reasons why it helps bone health, right? It helps to increase absorption of calcium in the gut. It regulates the calcium level by actually encouraging your body to secrete a hormone called parathyroid hormone. And parathyroid hormone is a hormone that's released from the gland that sits on top near our thyroid gland, and it helps to regulate calcium balance. It makes sure it doesn't get too high or too low. Vitamin D helps that gland function better. Okay, so now this one I also love. You guys know I love to talk about testosterone. Okay, so testosterone, vitamin D can help to boost testosterone production. Yes, I said it. Vitamin D helps to boost testosterone production. How? Because vitamin D actually helps by dilating cells. These are cells in the testes. For example, in the case of men, these cells in the testes actually have vitamin D receptors on them. So they're waiting for that vitamin D to bind. And once it binds, guess what? Downstream, it's regulating, saying, give it to me. Give me some testosterone. And it's going to make more testosterone. So you want to boost your testosterone level naturally? Yeah, you want to take your vitamin D level, okay? And you want to take your vitamin D and check your vitamin D level. Okay, so boosting testosterone production, that is a huge one, okay? So what about the effect on blood pressure? Did you know that vitamin D can also help blood pressure? Yes. Okay, so how it does this is there's something called the renin-angiotensin system, okay? So the renin-angiotensin system, just think of it like it has to do with your kidneys, okay? So it helps to regulate blood pressure, okay? How much water and stuff that the kidney holds on to and let go and so on and so forth. That whole system, we don't want to get into it in this video. But the idea is we can actually get vitamin D to influence this system and get our blood pressure better, okay? So if you have high blood pressure and your vitamin D level is low, that might be one of the contributing factors, and that is something you can easily fix, okay? So those are some of the benefits. We can go on and on and on and on and on about why I love vitamin D, and it's in all of my patients' supplement regimen. Okay, but let's talk about some risk. What is the risk? Everybody talks about this vitamin D toxicity that scares some people from taking it. Well, let's talk about it, okay? What is it about taking too much vitamin D that we're worried about? Okay, so one of the biggest ones, believe it or not, is nausea, vomiting. Yes, you hear it on every commercial, every drug, every supplement can cause nausea, vomiting, right? Okay, that's one. Then the next one is, okay, maybe it can also cause weakness and fatigue. If you take too much, yes, that can happen, okay? So again, reason why we want to check our levels and not just assume, okay, the more the better. Yeah, maybe, but not to toxic levels, okay? And when we say toxic levels, we're talking that your level is now higher than 100, okay? So on the blood work is the only way you're gonna know that, okay? But the most scary one is that you can actually damage your kidney, okay? So now, none of us wanna end up on dialysis, right? And you definitely don't wanna do something to yourself that will cause you to end up on dialysis. So too much vitamin D can lead to some dehydration, can start calcifying your kidneys, and that is the problem, okay? We don't want to overdo it to where we damage the kidney, okay? So that's one of the big drawbacks for me, but again, I don't take so much where my levels get out of that 90 range. So I always keep an eye on it, and you should too. Get simple blood tests done. Most of your insurance companies cover this test annually for you to check. Even Medicare, Medicaid, doesn't matter what insurance you're on, they allow you to check this at least once a year to check your levels, make sure you're not taking too much, and get your level right, okay? So I hope this has been helpful. Now, I said more than 75% of you guys are deficient. Every time I get a new patient in my practice, I'm checking, I'm going, really? Did your doctor check? Okay, just kidding. But seriously, guys, more than 3 out of 4 of you guys have a deficiency. So this is a video you need to share with everyone you know. Share it, let them know, let them start taking vitamin D, buy for them for Christmas, okay? It's a great present. You tell them it's your cancer prevention gift from you, okay? I'm telling you, they're gonna love you for it. All right, so hopefully this has been helpful. Comment in the section below if you knew all of this, or did you learn something new today. I'm hoping you learned something new. Let me know which one that is. All right, maybe I can expand on that topic. All right, I'll see you guys on the next one. Bye for now.